Namaskar. Who else but the rock star, the superstar of obstetrics and gynecology, the person who has delivered from celebrities to royalty, the one and only Dr. R.P. Soonawalla, whom we'll be presenting on the other side of the masters. The human value of a person like this would really be there to inspire us. Be there with us with Dr. Soonawalla. Good evening and welcome to this show. And this show is the human side of the masters. I'd like to share something with you. This show was conceptualized because of something which happened in my life. Somebody we lost, a mentor and a teacher for me, Dr. Rakesh Sinha, once said to me that whenever you meet a man whom you feel is a legend or great, try to spend some time with him and you would find such beautiful stories of his life which will inspire you. And you know what happened with me? 1 year back, I met Dr. Soonawalla at a program and he was kind enough to grant me an hour. And I just sat down with him and he told me 2 stories of his life which didn't only touch me, they really changed the way I started looking at things. So I thought, why not share these things of so many legends with everybody, where all of us could be touched, moved, and inspired. And this is the only reason that we thought we'll do it. Mr. Durga Satpathy from Intas Pharma was so kind to conceptualize, design, and create this with us. And you know something interesting? A person whom I met 1 year back, I've had the opportunity now to listen to him and to share with you his life, which would really be something for us to carry bits of it with us. राहत इंदौरी साहब के 3 दिन पहले इंतकाल हुआ. बहुत बड़ा उनका फैन रहा हूँ. बड़ी सुंदर चीज कही है उन्होंने कि यह क्या उठाए कदम और मंजिल आ गई. मजा तो जब है कि पैरों में कुछ थकान हो जाए. अगर आप मुझसे पूछें, ये जिंदगी, this lifetime of ours goes on and there is so much which you have put into it, which I'd like Dr. Soonawalla to share with us. And welcome on, sir, over here, the doctor who has treated royalty to celebrity and the who's who has trained thousands of doctors. And आपको एक बात पता है, मुझे इन्हीं के स्टूडेंट्स और पोस्ट ग्रेजुएट्स ने कहा कि इनकी उंगलियों पे सरस्वती बैठती थी when he used to do surgery. Thank you, sir. Thank you for accepting, and thank you for accepting a live show. I don't want to disclose the age, but in the 90s for you to have a live show, we are so grateful. Sir, welcome to the show.
No, I'm enjoying the show as much as you are doing, and we hope the listeners also get the same pleasure in watching this show. It will be a bit of it may be repeating a little bit of the last Legends show on June 7th that we had, but I've tried to omit and differentiate the two.
So all that we want is your life and instances of life as a human being. And I don't think we've had so many webinars on medicine everywhere. There is no medicine in this, and that's the beauty of it. And sir, there is something which I have always, let me start from the very beginning, that where were you born, sir? How was your childhood? How many brothers and sisters are you?
I was born in Bombay at that time. Now it is Mumbai. My father was a physician. There were five brothers and five sisters. And my grandfather was a engine driver in what was GIP at that time, the Great Eastern Peninsula Railway. And he was a highly principled person. They moved to Bombay in the young age, and it was the eldest uncle who was a solicitor who really brought up everyone because my grandfather was most of the time traveling. And two brothers became solicitors, two brothers became doctors, one became an engineer, so that it was a family of people all well educated. And the sisters, unfortunately, at that time, were not highly educated. They went through the schooling and afterwards they settled down in marriage. My mother's side was a, a liquor bar. Grandfather was owning, and that was also an experience for me. So whenever we went to meet him, he would be having a box of chana, and the hole was just big enough, and you can put your hand in, grab as much as you like, but when you grab too much, it won't come out. So you had to let go. And it was some sort of a fun we had, trying to pick up as many grams of chana as we could from that box. We were brought up in a very simple way. I'll tell you how simple. And today would be the day, Puppety New Year, when my mother would be going to Crawford Market and buying a full roll of shirt material, trouser material. And from that roll, she would be having my father's shirt stitched, we four brothers stitched, and also our cook and driver. So all of us were in same uniform. So we were brought up in a very simple way, not arrogance or no complex like that. And my mother was very fond of traveling, and she traveled practically at that time in the 50s, when travel was not very easy, to Japan, to Hong Kong, a lot of cities in the east, and a group of five means all friends and her sister, and traveled to Europe and to UK practically for 4 5 years. Every year they would have a 15-day, 20-day holiday together. So that was a very good spirit, and very much till the end. She would come to the Parsi colony Gymkhana and play badminton. And can you believe that age of 65, 70, she would be every day looking forward to coming and playing badminton on the court. And that gave us the background for the sports activity.
Sir, any incident during your childhood which normally children may not have had? Something different which may have happened?
We were four brothers, very close to each other. Between 1925 and 1930, all four were born. And we used to fight a lot. We used to have all the time the competition. And whenever it came to a problem, we four were together. And one incident which I remember very well means when we were small, we were staying in a joint house, a huge bungalow, so that each of my uncle and my dad had one room. So both my elder brother and the second brother, Fadun and Jamshid, they had to go to boarding school. And they were so small when they were sent to boarding school, around 5 years, 7 years, if I remember correctly, that the boarding school allowed a nanny to be there to look after them at that time. Moment we moved into a bigger house, my father was very unhappy to send them to boarding. So moment we moved into the other parts of the colony in a flat of our own, they came back and then joined the schools over here. And once in that, we had a sort of a fight every day. And my mother was finding it very difficult to control us. So she would call a neighbor who was the landlord of that building. We were on the second floor, the landlord was on the first floor, and the ground floor were rented out. This Dada Pasi colony came up in the 1920s or something around that time, or 1900 sometime. And there were compulsory rules about the buildings. They cannot be more than 2 levels or 3 levels, the ground. First floor, second floor. And every had a garden around. Unfortunately, now some of these buildings are replaced by high rise. So one night we were playing games. From the games, it became a fight. And we knew that our landlord would be coming up because it would be thumping on his roof level, the upper level, the noise and the jumping and all. So we decided, because every time he would come, he would give us slaps and spank us and go. And that day, my parents had gone out. So as soon as he entered into the flat and came into the drawing room where we all were playing, my brother put the lights off. So it became pitch dark. And four of us beat him up in whatever little way we could. We were quite small. And then we just ran and hid in the bedrooms. Then the light was put on by our cook. And the moment the light came on, we could hear this landlord disappear from the flat because we knew enough was enough. And
there is something which I have always wanted to ask you, and which I always ask a lot of people. Who was a major influence on your life? Your father or your mother, or either of them? And this is the kind of question which I'm asking you, which so many people ask you, आप मम्मी के बच्चे थे या पापा के? आपके कौन है? But otherwise, I just wanting to ask you the influence of your parents on you.
no, both. As I mentioned, the two elder brothers were sent to boarding. And therefore, I was number 3. And both my parents gave a lot of time, lot of attention. So much so that my early school, means Montessori schooling, was at my father's clinic. Every morning I would go with him. He had made a small chair and a seating place. My teachers would come there and teach ABCD. It was not a big education level, just the beginning of education. And my mother was, because of her boldness and her outgoing nature, she was very bold and a leader. And so whenever they went for a holiday trip, she would be the one who would be organizing everything and lead the way for this group to get together and move.
There is one thing which I would really like to ask you. How did you meet Madam, your wife, and how did you get married? If I'm asking.
She was also staying in the same Dadat Parsi colony, in an adjoining building, very much interested in sports. And we had a Maidan just behind. So we had a hockey team for the boys called Panjani Old Boys, and a hockey team for the girls, which was called Panjani Penzas. And both these teams were regular holidays together or picnics together. And then over a period of time, I started getting involved. In the beginning, my interest was more in sports and studies. And but then naturally, as I turned 22, 24, my interest in girls started developing. And when it came to my going to UK, and there was still about 8 months, 9 months, or a year in hand before I could go, my father put his foot down. Okay, I would like you to get married and go. I won't like you to go alone. Because at that time, there were a lot of instances where single Indian students going abroad came back with a foreign bride, which some of the families were not very comfortable with. So then I was already mentally very fond of Hilu, my late wife. We lost her in 1913 and proposed to her. So the marriage was arranged. And 1958 October, I got married. And by January, not January, by June, July, I had to leave for UK for my studies.
If you permit, there is one thing which I would really like to ask you. You have been a man who has mesmerized everybody. You've had such an amazing, I would say, fan following and a crazy lady fan following. Uh, it must have been a tough time for Madam to have managed it. Was she ever, in any case, did it ever crop up, or was there any kind of an insecurity, or whatever I could say in the words?
No, communication between us was very, very good. So she always had full confidence that as a gynecologist, I had to be meeting patients, all ladies, all types of, from different walks of life. But she never felt insecure that then I would be driven away or doing like that, anything of that nature. So that it might be or was sometimes bothering her. But as a whole, there was no issue on that. She never would point out any person in particular, okay, why do you meet or why do you go? She would be very, very tolerant and very sure of her own self.
Sir, I got a chance to meet so many postgraduates of yours. So they know so many things about you. They say so many things all the time about you. In fact, um, they would sit down for hours to talk about you. But one thing which I would really like to know from you is uh, just three things which people do not know about you, sir.
In the beginning, school days, college days, I had a very bad temper. And I would pick up fights at the minimal confrontation. In college days, we had a motorcycle. And the worst thing that can happen to a motorcycle is an accident because you're fully exposed, you fall and you break your limbs or you get badly bruised. And the Bombay taxi drivers were always coming from the wrong side, giving a cut, and that would really make us stop and be careful and all. So whenever sometimes some would be a bit rude and rough, I would just give him a punch. And then we would go to the police station, and the police immediately would take my side because I would be explaining how and why this happened. And so never got into any legal problem as such. They would start scolding the taxi driver more than taking or completely taking my side. So, and the temper, as I became more and more meeting different people, seeing people with temper, how badly everybody was talking about them. Our professors, some were very good and polite, some were very rude and rough. So I myself realized that temper is not a good thing in life. You might lose, but immediately you must control yourself and take hold, because you have to have good friends to be happy in life. You have to have plenty of good friends and plenty of, say, people with whom you have to work and deal with your work. And as a gynecologist, naturally, it was very personal sort of a work that we had to do. And I was immediately understanding that temper is not a good thing in life. So I never ever shouted at anyone. And if any false happenings would take place, I would not scold that person in front of the crowd. Say a student doctor or a resident doctor, I would just call the doctor aside after a while and then let him have it. Just look, so this and is not the right way, not going to tolerate it. You have to learn to respect juniors, even the ward boys, even the nurses. And that way, naturally, when I would preach that, I had to practice it.
Sir, um, you have been all over the world, delivering patients, all over the world. I mean, in fact, I was looking up on your biography, and I realized that you've been to Los Angeles, you've been to Dubai, you've been to London, you've been to Europe, you've been to Colombo, you've been to, I don't know how many places, India, apart from India, to deliver patients. You have been a very avid traveler from the very beginning. Have you traveled anywhere where you, well, it's a question which it's never happened with me, but have you ever had crazy travel experiences? Just like, have you ever traveled without a visa?
No, fortunately for me, the moment I entered practice, population problems around the world were becoming a big issue. So I got involved into contraception, family planning, and population stabilization. So, and that put me on with IPPF, International Planned Parenthood Federation, through two pioneers, Mrs. Ambe Wadia and Lady Ramarao. So, moment I was with that association, the meetings and conferences and traveling started taking place. Now, I was fortunate that when I was a medical student, the appliances available were nothing more than a stethoscope for watching the baby, a fetoscope, the small cone, and an X-ray. But after 1950s, sonography came in. Towards the end of 1950, sonography came in. After sonography, CT scan, CAT scan, genetics, endoscopy, laparoscopy. So I had the opportunity to try everything first. And I was very fond of teaching because to me, to deliver quality of care in your profession is a compulsion or a necessity for every doctor to keep that as their main goal. That whatever care they give to the patient has to be of a high quality. This high quality can be only possible if your knowledge is good and your practice or experience is good. So I had the opportunity to get the laparoscopes very, very early in 1968 when laparoscopy had just come in. And one condition was put to train the doctors. So we started training doctors with Christian Medical Association of India, which was having a base in Bangalore. Amongst the Christian different say, types, There are the Catholics, Roman Catholics, the Protestants, and Protestants have a little open mind when it comes to contraception, sterilization, family planning. So the CMAI, of which the hospitals, Miraj and, uh, and other main hospitals, there are more than 300 hospitals around India, which are all mission hospitals doing good service. And so we met the Dr. Herbert Bhatt, who was the head of the medical division of CM, in a conference. And we made a sort of a training program where, as a team, 5 of us doctors, my brother Fadoon, myself, Dr. Janki Punjabi, late Dr. Kusum Javeri, and Dr. Desai as an anesthetist. And we traveled all over India training doctors. Now, first we had the training program in Bombay proper at Wadia Hospital. But we found that we could train 3 doctors, 5 doctors. Well, if we went to the place where a mission hospital was there would be 50 doctors to be trained. So that in few more, say, days, we would be at least training many more doctors than we would if they were individually visiting us. And this program started becoming very popular. And then with IPPF, there was an Indian Ocean region, which consisted of Iran, Pakistan, Bangladesh, Nepal, Sri Lanka. And we were very much ahead in our medical practice. So the teams from Pakistan started coming, then teams from Colombo started coming, and then we started going there and training the doctors. So once I was invited by Pakistan for that first gynae conference. And in that first gynae conference, and I was lucky to be like one of the guests of honor. Mainly the main important guests were the British doctors who had trained the Pakistan doctors. And I got a letter from the Pakistan government about this program because it was a military rule at that time and they were controlling everything. I finished a conference in Australia, and then I came back to Bombay. I had about 15 days in hand. That time I used to travel practically 2 or 3 times in a month. So I had very few days in hand. And to get a visa to Pakistan, it meant you had to send your passport to Delhi. Delhi would send to Islamabad. Islamabad would check and approve, come back to Delhi and to you. So there was no time. I phoned the organizers, who I knew very well. And because they had come for training and we had met in many conferences. So they said, don't worry about visa. We'll meet you at the airport and we'll get a visa for you. The mistake was that the conference was in Lahore and my flight was Mumbai to Karachi. And early morning, I landed in Karachi about 8:39. And the immigration officer, very polite, but very stubborn. He flatly said, sorry, doctor, there is no visa. I cannot let you in. So I said, then let me go back. And my secretary at that time was a Muslim girl, Amina by name. Her sister was a lawyer in Karachi and she had come to the airport to receive me. So she kept on telling me, hey, please don't go back, please don't go back. Let the government open up. And at 10, the offices opened and she phoned Islamabad and fired them. And she phoned Lahore, the organizers, and fired them. She was really a legal person who could do it. So suddenly I found 2 ISI officers come. very smart looking, very smartly dressed, red berry caps, and super health. Those Peshawar, Punjab type of people, they came and just immediately, doctor, sorry, we are very sorry. Because at that time I was also going to WHO meetings. So my passport had many stamps of Geneva and all. So then they saw my passport, and there were small cubicles. I was waiting in one cubicle. I could hear them fire that immigration officer. How dare you? This is an insult to our government. When it's a government letter inviting the doctor, you have no right to, for a visa purpose. Then he was arguing, oh, when we go to India, we get the same treatment and all that. Then there was a few flights to Lahore. I had missed my flight. I stayed in Karachi. The ISI people came in the morning, picked me up, put me on a flight to Lahore. And only thing I had was a letter giving the permission to enter Pakistan. Then Lahore meeting got over. And coming out, the immigration officer asked for passport. It looked at the passport, where is the stamp of entry? So then I showed that letter. The moment they saw the letter from the agency, they didn't ask a single question, just took my passport and said, go. So that was a very, for a moment, very tense. But the moment these two officers came and they took over looking after me, my journey through Pakistan was very, very smooth. And second time also, I gone with my wife to Lahore for a conference. And all my Pakistan friends kept on inviting to Peshawar, to Islamabad, to Karachi. I did not know that when you go to all these towns, you have to have special separate visas. So we landed in Lahore and we had the immediate connecting flight. But fortunately, the Pakistani people and Indian people in looks are very, very similar. So the Lahore doctors told me, don't worry, you have no visa, but we are calling up the next person who is going to receive you. So we flew without visa from Pakistan to Peshawar, went into Khyber Pass, then came back to Islamabad, and then back to Lahore. All this was without visa. So enjoy that at times, but it was not a routine. In emergency, I would not be hesitant to enter a country knowing if you hold your passport and give a good explanation, nobody will bother you.
Ever happened anywhere else with you, sir, where you got stuck because of visas? Because Pakistan is interesting, but anywhere else, again, it happened.
No, but that was a very peculiar situation. After 84, we had formed a group of two couples from US. It at one time became 3 or 4 couples too, and 3 couples from India. And we would have a holiday together. And we have done practically 6, 7 cruises and lots of flights to different parts, China and Latin America. So we were in Miami. From Miami, we all met, went to Peru, to Machu Picchu and all that area. On a Sunday, we came back to the airport, and the immigration officer just said, you people have a business visa, not a tourist visa. And for business visa, you have to get the clearance from the Commerce Ministry in Lima, Peru. And we were in Lima. Oh, we were then, the flight was to come within an hour and no visa on a Sunday. And there was a local gentleman who knew one of our say travel partner, a friend. He came to the airport naturally to leave us, and he approached the immigration officer. They made some arrangement, and the arrangement was whether there's a tax or what, that we had to put $100 in our passport and present that passport, and we would get the immigration permission to leave the country. So this was also, for a moment, very tense. Now, what are we to do? Because our whole trip from Peru was to Chile, Santiago, and then to Argentina. And the whole circuit would be completely, say, disturbed if we missed any flight. But we were lucky that we did manage to get the exit permit and left Peru.
It's very interesting because everybody, there is a time in their lives when they go ahead and they have to bribe. But then for the moment, that is the best choice, which probably would be there. I'm wanting to know from you also something that has it ever happened that you have been had to go to a coronal or had to go to a court or had to be in front of a judge because of anything which you did medically, sir?
Medically, I was involved in helping unfortunate girls or women, married women, who were caught with an unexpected pregnancy. And although in India, the laws were liberalized in 1972, right from 65 to 72, we were able to help women by doing a termination of early pregnancies. But once in a while, we were caught with an advanced pregnancy. And at that time, new techniques had come in. So one day to the family planning center, a gentleman from Bihar came with two folded hands and he said, I have a problem. My wife is now nearly 4 months pregnant. I've got 4 kids already. I cannot manage this pregnancy, but this pregnancy, my elder brother is responsible. And in the village, how will I face the public or people when I'm in Bombay and my wife is carrying a baby? So we gave a thought and I decided, no, he needs help. He said very clearly, if you help me, I will take my wife back and I will not be at all angry or upset. But if she has to carry with the pregnancy and deliver the baby, I will have no choice but to kick her out, because it would be a bad slur on my reputation and with her, the 4 kids. So I gave a thought. I consulted one other doctor who was working in that nursing home, and she said, yes, yes, we will help out. So at that time, for a advanced pregnancy, second trimester, as we medically call, there was an injection of hypertonic glucose, which you injected into the pregnancy amniotic fluid. And after 24 hours, that would irritate the uterus so much it would be like a natural miscarriage and the baby, whatever fetus, would be expelled. So we gave that injection in the afternoon. She was admitted in the hospital. She stayed, and next day afternoon we would be expecting that the pains would begin. But in the morning, whilst having breakfast, she developed an embolism, which was known as a common complication, not very common, but one of the complications of this procedure. And with the embolism, they just dropped dead. So she literally was having breakfast. She complained of pain and fell right on the tray, and she was no more. We were in absolute panic. Now what to do? Now what to do? So we had to report to the coroner because it was not a natural, say, situation where one can explain her death. She was very young, maybe in her 25s, 28s. So I informed the coroner. He called, we had to get the death certificate from the coroner. And I went over to the coroner. He was a Catholic gentleman, and Catholics at that time were not very keen to promote family planning. I gave him the whole story very clearly why we decided to help because of the 4 children, because of the wife's future life, and because understanding the husband to accept that was the main thing. So I explained everything, and he just sat there looking at me straight in the eye. And I learned one thing. When we meet somebody like in Uganda, there is the gorilla area. And people go there, gorillas are vegetarians. So they are not going to attack you. You don't look in their face. You submit to them, look down. They will come near you, they'll pat you on the shoulder, they might push you, but they don't do anything. The moment you look onto their face and with anger, they will immediately attack you. That was what is the situation. So I did look at him, but with very not glaring and staring eyes. Then he just asked, "How much did you charge?" So I said, "Nothing. On the contrary, for the antibiotics and all, our clinic paid for it." So again he sat for half a minute, but that minute looked like half an hour. He just took the pen and signed the death certificate. I was so relieved. And the moral behind this, that all human beings have a soft corner. And you have to be in a sort of attitude to see that soft corner and be friends with that person. You can get the best out of that person. The moment you antagonize people, your happiness is not so good or is compromised.
Yeah, we're back. We are back. Yeah.
No, I can't hear you.
Can you? Okay. So, hello. Yeah, there was a little bit of problem with the internet, I think, at some end. So this is what happened. So these beautiful stories which I listened to, मतलब इनको सुन के सिर्फ एक चीज मुझे वाकई महसूस होती है, बोलूंगा थोड़ी सी उर्दू में और हिंदी में, you would get it, I'm sure, कि जिंदगी तस्वीर भी है और तकदीर भी, फर्क सिर्फ रंगों का है, मनचाहे रंगों से बने तो तस्वीर और अनजाने रंगों से बने तो तकदीर. And this is exactly what these small instances of your life especially would be there for all of us. I was just wondering, you have been so closely associated with the MTP Act, formulated the MTP Act. And during that time, before that, you have spent a very long time in England. You worked in England for a long time. What have been your experiences in England from which there was something which you would like to share with us, sir?
Yeah, I very firmly believe in destiny. There's something which guides you or guides your life and all. So I'd gone to UK to do FRCS and MRCOG. And I had to have a 6-month surgical experience, which I had done at Wadia Children's Hospital, which was recognized by the London FRCS. When I went there, the MRCOG people said, no, this is a specialized, children only. So you have to do a general. So my wife and myself started looking for a post. And BMJ is a journal where every week a whole list of jobs come. She had a handwriting very similar to mine. And every day we would be sending 15, 20 applications to different hospitals for a job. At last, when my luck opened up, we were called for an interview. I was called for an interview. And my wife came with me. And it was St. Bart's Hospital, St. Bartholomew at Rochester, a center which was known to be excellent for surgery. And the surgeon, there were two top surgeons and two assistant surgeons. And one of the assistant surgeons was very polite, very gentle, very good. The other was also very gentle, very polite, but a single unmarried person, an excellent surgeon. Excellent. He had articles written, his techniques were in publication and all. Well, my boss was very simple. And the moment he came to know that I had done primary FRCS, and in India I had done so many cesareans, working at Wadia, was an experience out of this world. The amount of practical experience you would get in obstetrics. So he would give me a lot of opportunity to operate. So one fine day, about 12, 13-year-old girl came with pain on the right side. At that time, appendix was a very common thing, especially associated with constipation, young girls. So, and we had not much. It was in 1959, 60, 1960. So and she was in so much pain that we had to decide and take her up for surgery. Whilst taking history, a lady who had brought the girl said she was from a broken home. Her parents had separated, and her grandmother, who was now very old, looking after her. So please take care and all. So my boss was waiting out in the surgeon's room, and I started the operation, made a cut. At that time, there was no laparoscopy. And I found the appendix to be completely normal. Being a gynecologist, I examined the uterus, and I found the uterus to be bulky. So I reported that to my chief, and we were all, it was in the night, the anesthetist was a Catholic, the chief was a Catholic, and the nurse was an Australian nurse, so the theatre nurse. So they just said, no, we have to do something, we have to help her out. So my boss asked me, will you be able to terminate? I said, I've done plenty, because we were working on termination of pregnancy and all that. So he said, then please go ahead. So theatre mobilized the dilators and a sponge holder. At that time, suction was not there as a method. A sponge holder. I slowly dilated the cervix, removed the products, and then luckily everything went well. So at certain times, a little bold attitude in life, if you are very clear in your mind, very clear in your approach, because then your hands don't shake. If you are nervous, your hands start shaking, you don't know. So you have to have a firm conviction in whatever you are doing and a full belief that what you are doing is right. If that two are there, you will always be a very successful doctor.
Fantastic, sir. And any experiences in the Indian theatres?
There
must be a load of experiences in the Indian theatres. So what all have been the experiences whenever you have practiced, small experiences which you
Yeah.
could just share with us.
No, as I mentioned, yeah, I always believed somebody was always there to help me and guide me. And I'll tell two, three very simple ones, then the main one. One of the leading cardiac surgeons of Bombay, his wife was a diabetic, overweight, and needed a gynec surgery. So I saw her, and there was no way we could get rid of her problem unless we do a hysterectomy. So we planned a hysterectomy. It was decided in their own hospital, which was very well settled, very well. It's a good, it's a institute. The wife got admitted at about 4 in the evening. All the medical tests were done, X-ray chest, whatever, cardiogram, 2D echo, everything was done. And she was resting in a room around 9 o'clock. And surgery was to begin at 8 in the evening. So she was supposed to be having some very light meal. Having that light meal, she got a cardiac attack.
Oh,
Um, Being in the hospital, immediate treatment was given. She survived and all, but we had to postpone the operation. So I started thinking, by chance, instead of 9 in the night, if the cardiac attack had occurred at 9 in the morning, what would have been my fate? It would have been impossible to explain to anyone it was a natural cardiac episode which took her life, made it dangerous for her. But luckily, she survived for a couple of months after that. The operation we could not do.
so
Uh,
you, yes, sir.
then, so right from 1966, I was going to Delhi for ICMR meeting, Government of India meetings, having put my foot into family planning and population stabilization. And then there was a lot of friends who would ask me to see a patient, start or help in operation. So my practice in Delhi very gradually but very rapidly built up. And I was operating at various nursing homes, and even only there's the the main private hospital in Delhi. Someone, I'm missing the name. So Apollo. Mr. Dr. Apollo, in charge of Apollo, had given me full permission to come and operate and use the facilities in the two Apollo hospitals. So there was a lady, second pregnancy, placenta previa, and without recognizing that it was a pregnancy, she had pain, and they had done kidney pictures and all that. So first thought was, can the pregnancy be continued in spite of so much of radiation? Luckily, they were in a position, they flew to US, consulted two institutions in US, and both the institutions said the amount of radiation is within a tolerable limit. Termination is not required. After that, they had come to Bombay to see me. By the time she was about 4 or 20 weeks, 18 to 20 weeks pregnant, I saw her, and placenta previa, we had to plan a surgery. So a surgery was planned for a Friday morning, and I was to leave Saturday morning for Pune for a conference, and Friday we started the operation. And baby came out, baby was quite all right, but she started hemorrhaging so badly. And luckily, they kept 4 bottles of blood ready. which was used. Now, husband was a politician, a very big politician. So we asked for donors. They managed to get 150 people within few hours. So they were just being blood grouping and matching was done. And we could not do HIV testing. At that time, HIV had just come in. We could not do anything more. In total, over 3 days, we gave her 45 units of blood. I immediately called for a proper second anesthetist because we had to push blood in. And believe me, the two anesthetists that came and helped were as if I knew them like good friends. They were so helpful. And I said, can we call a vascular surgeon to ligate the internal iliac? And immediately a vascular surgeon came. And I asked for a surgeon also to be called. Well, another surgeon came. So that it was a team helping me with full spirits. Not that outside doctor has come, outside doctor is operating. Why should we stretch ourselves? And we had to pack the uterus, and we decided, combined decision, nothing can be done now, she's too low. And at that time, the surgeon gave a very good suggestion, which the medical people will be able to. If we close the abdomen and have to open again to remove the uterus and the placenta, intestines would be stuck to that whole raw area and the surgery would become very difficult. So the surgeon asked for thin plastic and he put in as a membrane separating the pelvis from the abdomen. And then we packed the uterus, stopped the bleeding. She was in ICU. I canceled my trip to Pune. On Sunday morning, the surgeon, the vascular surgeon, with my also assisting, we opened up the patient again, and luckily no adhesions at all. Removed the uterus, subtotal hysterectomy was done, and luckily the patient was touch and go from Friday to Sunday. By Sunday after surgery, her condition started improving. She was a very tough lady from Himachal. And believe me, it was the physical toughness of that lady that we, with the medical help, could save her. If it was some delicate person, it would be very difficult to withstand that sort of a tough surgery. Look in the picture. The other time was again a very interesting practice and experience. The intrauterine contraception was introduced into India, ICMR, for trial in the 1960s. And there were so many people that came for intrauterine contraception. Unfortunately, the selection of the cases was not good, or the experience of the doctor was not good. The whole program had a setback. And these people were mentally prepared to undergo a sterilization. So when they came for IUD removal, I would talk to them and do a vaginal sterilization at the same time. And we started doing vaginal sterilization as a team in a very big way, camps, doing 200 cases a day, 300 cases, lots of doctors, lots of tables, and we were doing very well. So the Delhi Obs-Gynae invited us, and we went as a team to operate. And the very first patient we tried starting vaginal was so difficult because the patients they operated in Maharashtra and people coming from South were all small built, and depth of the vagina was much shorter Then the hefty Punjabi women, overweight. And so then we understood that no wonder the Delhi doctors were not very keen to do vaginal sterilization.
There is, you also, sir, you also have traveled to Delhi and worked in All India Institute as well, in long time back. Anything which was, and something which you really got out of it, something which you carried with you?
No, it was a very VVIP delivery, and without realizing, Prime first baby, I was going and checking her, and came to delivery, and the delivery was planned at All India Institute. So initially there was a little resistance from All India Institute, outside doctor cannot come, but that was all overruled. And then I kept on asking the anesthetist. He was a doctor who had done the training in Bombay, and good anesthetist who had joined All India Institute. I asked for epidural. He said, we do plenty of epidurals we are doing, everything is fine. So I trusted him. I trust people easily, and I trusted him. Then the delivery, one Saturday I went, there was a short of labor, but not right labor. I stayed till Monday. Monday I flew back. Then that time, with the husband, we discussed, and it was decided that it was already full term. Why not induce? So we planned for induction next week. And I flew again. After induction, when the time for epidural came, the anesthetist came, took a stool, sat by the patient, and started telling, if I can give epidural to many, many people, I can give it to you also. But if you get a backache for lifetime, then don't blame me. I was just shocked when I heard that. And there was no way, no way. And it was phase 2 pubis. And luckily, she progressed very well with Pitocin drip. And we took her into the delivery room. And in the delivery room, I just couldn't get confidence of any other doctor around me. Because that moment I felt, yeah, they will definitely not be of great help to me, because with a lot of resistance, I had the permission. So I applied forceps. Luckily at Wadia, the application of forceps and all was so common that we had a tremendous experience. So I applied the conventional forceps, pulled the baby out, put the baby in my lap. The pediatrician came, I just pushed it, resuscitated the whole baby. And once the baby was resuscitated, I gave it to the pediatrician. And then luckily everything went well. And I came back to Bombay and met my elder brother, Fadun, the surgeon. And I was narrating to him. He said, it's not right on your part to go for a delivery as a single person. We surgeons, when we go, we take our anesthetists, we take our assistants and go and operate in new institutions or anywhere. How dare you go alone? You should have taken your anesthetist, your assistant to deliver. So that was a big lesson I learned, that without thinking, without experience, I just agreed. And normal delivery, but things can become a little tough. Luckily for me, having worked at Wadia for years as a registrar, the number of deliveries we had done the performance of Wadia at that time was 12,000 to 14,000 deliveries a year. So every month, 1,000 deliveries. And we were continuously getting, there was no Sion Hospital, there was no Cooper Hospital. So right from Kalyan, Thana to Parel, all the emergencies that occurred in nursing homes were transferred to Wadia. And that was the fortunate for me that much experience, I could manage the delivery.
Sir, you have given so much time to our city, Delhi, that there is somebody from Delhi who wants to say a few words to you. So it's a surprise for you, but can I please have the video? Can we please have the video?
Okay. Oh, Ashok.
Ask me today, who is the one man who has influenced you greatly in your approach to a patient and in your approach to your profession? I'd have only one answer. R.P. Soonawalla. And this happened the very first time I encountered him. It wasn't a personal visit, it was a voice on the telephone. And he said, "Hello Ashok, this is Dr. R.P. Soonawalla. I practice in Mumbai." I was completely taken aback. And I couldn't believe I was talking to the legend himself. I'd heard about him. And then I realized that I have to change myself completely. I've not been able to do that, but I still hope to do that someday. Because if a voice could change me that much, you can imagine what would have happened when I did meet him in person. The feedback from his patients had already taught me that I have to completely change the way I look at life, the way I interact with my patients, the way I approach diagnosis, the way I approach logical thinking in the medical profession. But when I saw him operate, I realized that the way I do interventional procedures in obstetric ultrasound was also something that I needed to change completely. I've been happy to change, and bits of that have fallen into place, but a lot needs to be done. And here is a man who continues to inspire me, has been doing so for 4.5 decades, and I know that he is the finest human being I would ever meet within the profession. I am truly grateful to him for inspiring me.
Thank you, Ashok.
So he just thought that since you were talking about Delhi, somebody from Delhi would like to say something, sir. Sir, I believe you have been one of the pioneers in microsurgery and laparoscopy. And one of the first procedures ever done, you did on the actress Mumtaz. Can you tell us something about how it happened, sir?
Mumtaz and her husband Mayur were settled in Nairobi, and they have a big business in East Africa, Uganda, Nairobi, and all. And after marriage, she started complaining of pain on the right side. And the Nairobi doctors could not diagnose or didn't feel sure what was happening. And they all mentioned being a celebrity, it could be psychological and nothing is wrong, nothing like that. So they flew to UK. And there the doctors also somehow, I don't know how, but missed it and said, okay, no, nothing to be done, just wait and see. In the meantime, one of my patients who's no more, who was really very, very communicative type of individual, and she knew Mumtaz well, and she told Mumtaz, just fly to Bombay. So they took the flight, came to Bombay. At that time, they did not have a big establishment in Bombay as they have now. So they were staying at Taj. And the Taj doctor said, on our panel is another doctor. Luckily, he is a very close friend of mine. So immediately when they mentioned my name, he informed me. And next day morning, we did a laparoscopy. On laparoscopy, we found a chronic ectopic in the right tube. So there was no way at the time, there was no laparoscopy, I didn't know operative laparoscopy as good as it is now. So we made a small cut, removed the ectopic, repaired the tube, didn't remove the tube, repaired the tube. And then luckily, after a couple of months, we did an HSG and both the tubes showed perfect picture and she conceived. And that she developed so much faith that for delivery, although Mr. Tompkinson was the doctor in charge, also a friend of mine, I was asked to be present at the time of delivery. And then later in life, one day got a call. Previously, she would be calling for cough or cold or fever, any problem, she would be calling from London. Then next time, I got a call that she was flying to Bombay because she was worried about a lump. And English doctors somehow said, we'll keep a watch. She has got a very sharp mind and very particular about health and exercise and all. So again, they flew to Bombay. When I examined, a tiny number, and we had a good team. Dr. Arun Kutkare, late Dr. Arun Kutkare, he saw and he said, no, it looks nasty, we have to remove. So we operated and did just a lumpectomy. That lump was removed and it was nasty. She took it so positively. People would get nervous, I've got this and that. She took it so positively. And what was the follow-up treatment? We said radiation, chemo. She went back to London, took radiation and chemo. Now she is 100% all right. 100% all right. It's years gone. It's years gone. And one thing which I would also like to mention, that both the husband and wife have become very, very close friends. We have been on holidays, the whole family, to Uganda, to Nairobi, and we practically enjoy every moment that we are having together. And one joke or funny thing, 2 times in the news, it was reported that Mrs. Madhwani is not well, is hospitalized, is very serious, somebody playing a mischief. And when I would phone her, she would say, no, I'm absolutely comfortable, I'm at home, there is nothing wrong. And this sort of false news came twice to India in the last 3-4 years. So this is how some people play a nasty joke by spreading false things.
And I was reading your biography, and there was a very interesting incident. Of course, you have operated on a lot of celebrities, I mean, film stars and industrial houses. But about Maharani Gayatri Devi, I mean, at that time, she was the most, and still must be, still is, one of the most beautiful women ever. And her surgery was something very tricky and something which you were involved with. Can we have some experience about that, sir?
Yeah. There are two people who I admire. One from the profession is Lord Robert Winston from London. And amongst the patients or celebrities is Rajmata Gayatri Devi of Jaipur. For their firmness, their belief, their attitude to life, and very positive, very, very positive. So she had a lot of problems and was in New York, and operation was planned, but somehow she was very nervous and refused the surgery. Then her husband came to London and somehow convinced her to get operated. She was on the operating table and she started coughing. So the anesthetist said, sorry, we can't operate with a cough. And then the Lady Ramarao knew her very well. And Lady Ramarao told her, kindly come to Bombay. We have a doctor who will be able to do the same thing as any doctor in the foreign country would do. So she flew down. On Monday, the general practitioner of Bombay, who was their family doctor, phoned me, there is a VIP, I want you to come. Whenever a VIP was there, we gave a time a little early in the day, not with the crowd. And I immediately put on the tie. At that time, I used to wear a tie and went over. And I was surprised to see her. I was not told that it was her. And huge tumor, fibroid. So I suggested there is no way we have to operate. So she said, when? When she said when, I got very panicky. Suddenly to agree. But I had the support of my surgeon brother. He used to always come and assist. And since I'd done a lot of general surgery, when he would go on leave, I would look after his practice, removing gallbladders, doing partial gastrectomies, because that was a lot of experience I got at St. Bartholomew's Hospital. So she said, I'm phoning my husband, and he flew down on Wednesday, and Friday the surgery was fixed, and which can be. And we made a fine seal cut and did the surgery. And believe me, on the third day, at that time, patients used to stay till 7 days. She was up and walking and said, I want to go home. And 4th day, she went home. On the 8th day, she invited my family and myself for a dinner at Taj. And believe me, the positive feelings that was coming from her, everybody at Taj would be just moving away, seeing her, and many people touching down the feet. And so the royalty in India was really so popular with the public at that time. Now it has completely gone away, And then naturally, we remained in contact. And when the late Maharaja expired, I was asked by the secretary to fly to Jaipur in their private plane. I attended the funeral, and then the friendship remained for a long, long time.
सर, मतलब आपकी बातें सुन के एक छोटा सा शेर, 2 लाइनें याद आती हैं मेरे को कि मैं सूरज के साथ रहकर भी भूला नहीं अदब, लोग जुगनू का साथ पाकर मगरूर हो गए. So, sir, it's so beautiful. It's so beautiful. And, in the same context, I would really like to ask you one simple question, which I have always wondered, but I would like to ask you. What is the secret behind your treating the who's who of this nation?
One would be luck. Or, as I said, somebody looking after you and giving you the good opportunities. When I started practice, there were 2 top gynecologists in the city of Mumbai, Dr. Purandare, Dr. Shirotkar. And both were retiring from practice. So it was the right time for me to step in. And the 2 giants were retiring at that time. Then the second thing is transparency. I believe that one has to be very, very transparent. If you have made a mistake, don't try to hide it. Always openly mention it. You may mention not the um, uh, magnitude of the mistake, but take the blame. I would never blame a junior doctor assisting me for any mistake that he or she would do. I would always take the blame myself. And I found that good communication is the secret of happiness in life. Communication at home, communication in your workplace, communication with your friends. If you maintain a very happy and a good communication, that would be the best thing in life that can happen. I remember a very funny incident. I would like to narrate that.
Yes.
At St. Bart's Hospital, assistant consultant moved to a hospital in London, and a new consultant came in. I will just say Mr. T. He was very arrogant. In the theater, throw instruments, shout at people, and in no time he was disliked because the main boss was so polite, so gentle, and this guy was just throwing his weight around. Anything would go wrong, he would be blaming the doctor, blaming the ward nurses, and he was somehow very, very aggressive sort of a person. Now, with me working was a Canadian doctor who came to London, who was the owner of gold mines in Canada. And he has given us teaspoons with gold nuggets. I've still got that. And he was very frank, very open. So one day, Mr. T operated, and an operation which should take 1.5 hours took nearly 2.5 hours, struggling away. Patient lost a lot of blood had to be given. And next day morning, he was taking a round, and the patient was recovering, but not comfortable. So he started shouting at the ward sister, shouted at the Canadian doctor. I was also just watching. We couldn't do anything. Being a boss, we had to keep quiet. The Canadian doctor slowly looked at the guy with very firm eyes and said, Mr. T, my name is Dr. Rooks. I'm not Jesus Christ. And the moment he said Jesus Christ, believe me, the message went to the doctor so well, his whole attitude changed a lot after that.
Sir, it's beautiful. And these are such interesting issues because I've heard from so many people that they've never seen you angry, they've never seen you lose patience, and they've never seen you lose your cool. I would just like to ask you, what is the secret with which you deal with the stress when you treating the high end of this country? Is there any stress or not?
I
Or
would,
there is?
I would give
What is it?
100% say credit for that, but my parents, they both were so gentle, so polite, so caring that we four brothers was the center of their whole happiness in life. Whatever they did was to make sure that we got the best of education, we got the best of food, we got the best of physical attention, games, sports, encouraging us in all that way. So I would definitely say both the parents were so close to us, and our communication by 7:30 we had to go home. Before coming from school, had to have a glass of milk and some snacks, then go for games and sports. So that from the young age, that trend is set in.
And sir, the beauty is, it's not only celebrities and royalty and politicians or VIPs. If anybody asked you something with love, You were always there for them, love and respect. I believe and I've heard you were never able to refuse these things to people.
Yeah, if I'm properly given the circumstances and a good explanation, I can never say no. I would stretch my neck out to help that person. So I got the call from Kanpur, and a very polite gentleman said, Doctor, will you please come to Kanpur? I'll arrange everything. My daughter in law is pregnant, carrying twins, and there is a risk of miscarriage. And the pregnancy had reached about 20 weeks or 4.5, 5 months. I said, impossible to fly to Kanpur and do what? And at that time, we were putting cerclage, Dr. Shirlker stitch, what was called, to support the pregnancy, especially twin pregnancy and a very short cervix. So I said, no, impossible. You do anything and fly her to Bombay. Then after 2, 3 days, he asked my secretaries, and I believe in keeping 4, 5 secretaries because there was a Dutch gentleman who had become a great friend. And he was always telling me, okay, don't hesitate in keeping a good staff around you because your burden will be shared and they will look after everything. So at one time, I used to have 5 secretaries working with me. But the need was there. My travels were so much that one was in charge of travel, one was in charge of foreign patients coming, and 2, 3 were in charge of reports and like that. So the work went on very smoothly. And so I went for an ICMR meeting. When the meeting got over, the um, peon at the door told me some gentleman wants to meet you. So I went out of the conference room because the meeting had already got over. It was about 4 in the evening. And he just didn't say anything. He just stood there with 2 folded hands. And I said, Doctor, I know you have no time. I know it will be difficult. But for my sake, please come to Kanpur. And he appealed with so much of politeness and so much of feeling that I gave a little thought and I said, okay, I'm coming. I immediately phoned Bombay, and Jet Air, Indian Airlines were all very friendly. At that time, I don't think Jet Air was there, Indian Airlines. So we had sets of instrument for cerclage. So I told one of the girls to pack it properly, sterilize it, and send it. And that set arrived by the morning flight, luckily. Then I met the gentleman, and he said, I've chartered a plane. So that took me back. I said, but it will be very expensive. He said, no, expenses is no problem. They had a very big shoe business, very, very big, foreign exports. And he said, no, I just want to make sure your time is precious. And then, so that sort of gestures made you feel obligated to help that person. And we met at the airport, we flew to Kanpur, and it was in a nursing home that was fixed. I went to the nursing home. It was shocking. Again, I was caught alone because there was no table with a good head inclination. Because for cerclage and membranes which are a bit, say, tempting to protrude out, one has to give a good head low position. The anesthetist was good. So when I saw that table, I just said, but how can we manage without head low? So anesthetist said, no, wait. He called the ward boys and brought 4 bricks and put two bricks at the table, and we gave a good head low. And then he gave the anesthesia. I put the stitch. Because of the I'm not boasting or saying anything. I was so lucky to get so much of operative experience, so much of obstetric experience in whatever short time that I worked in hospitals, that I managed to put a good stitch. Then, same evening, the flight took me back to Delhi. Next morning, I flew back to Bombay. And then, after a month, Dr. Nagarwala, my colleague, flew to Kanpur and flew with the patient back to Bombay. We admitted her in Masina Hospital. She went to full term and we delivered her. The twins were safe, everything went off well. So then, for the fees, we just said the routine fees and all. We never take pride in situations and charge more or less. And for years, every birthday of the twins, nearly 10 to 12 years, he would be sending a check to Masina Hospital of 50,000
Oh my God.
rupees.
Oh, wow. Wow.
And I do meet him now. Now they have stopped sending to Messina. He sent it for at least 4, 5, 7 years. And he's still keeping good health. And on phone, we are in touch once in a while.
Beautiful. Beautiful, sir. What will be your advice to all young doctors?
The medical practice 70, 80 years ago was completely of a different kind. Every doctor was a friend of the family, an advisor of the family, and like a part of the family. And the doctor was thought of like a god. That was the common expression the people would use. Then, after a while, I'm not blaming the doctors. The whole situation changed. The cost went up and up and up. So doctors also had to think of the cost. And slowly, malpractices started getting in. And in the malpractice, the kickbacks and all are there. Now, when a new doctor joins practice, he has a dilemma whether to fall in this trap and start giving kickbacks and develop a good practice, or avoid kickbacks and take your own time to, yeah. If you go for a specialization, not jack of all and master of none. There are many specializations nowadays. Endoscopy is one. Microsurgery is now back because of endoscopy. But high-risk pregnancy, infertility, IVF. So if you stick to one specialty and make a good name, believe me, the practice will come. I'll give another short story. When you start practice, you're very eager to please everyone. I practiced for nearly 10, 12 years. I started practice in 64, 63, 64. And one family doctor started bringing one patient, two patients, three patients, and then I had to block a whole Saturday for him. He would come with 10, 15 patients. And after we would see the patients, his wife would come with food. So we would sit and have lunch together. So one day I asked him, can I know what makes you bring the patients to me and not to other doctors? And I was so happy to learn. He said, when I was taking to other doctors, when we were coming out, they would always try to push an envelope in my hand. And he had a very big practice, very well off. So he said I would just push them away, still they wouldn't realize my respect is more important to me than the money. You have never offered any money. You have offered tremendous respect to me. Moment I phone, you come on the phone. Moment I ask for appointment, you give the appointment same day. And this is what I want. I don't want money. So this is what the doctor, to keep your own self-respect, you have to respect the other doctors also, their time, and that your attitude with them should be very friendly. Whenever they phone, be polite on the phone, talk as much as is required. And if they make a mistake, never point out that mistake in front of the patients of the relation. You tide over that mistake, you might say, yes, there are other ways also. And normal opinion or explanation I would give is, okay, supposing from my clinic, if you want to go to Fountain, you can take the Marine Drive, you can take the other road, inner road. So this is just a question of reaching your destination, which is Fountain. So some doctors would like to take Marine Drive, some doctors would like to take the Queen's Road, inner road.
Right,
So
sir.
that way I would just give an explanation.
This is so
So,
beautiful, so inspiring, and so practical. Love it, sir. Uh, what cannot you tolerate, or what don't you tolerate? I mean, you have no tolerance for what?
the first is dishonesty. The moment I find, and I've been unfortunate to have many occasions where financially trusting people, investing, and find that the whole investment was siphoned away. And three times, not once. But then I just forget it. It's bad luck. And that dishonesty is something. And when a person is dishonest, I would just stop talking. I would ignore her. And I would make it very evident to that person that I don't want that person as a friend. That is one thing which they cannot. And one thing is violence. Violence. This world is getting violent for nothing. A war is so destructive. And
True.
now, when a survey was taken, 60% on one of the television surveys of Indians, whatever the number was, I don't remember how many people were surveyed in that. 60% said, hey, India should go to war with China. Now, it is absurd. Not that we may not win, but we will win. But the amount of casualty, amount of expense, the amount of damage a war causes, with what benefit? Nothing. Nothing. So violence is something which I would definitely dislike. And the third thing, as a gynecologist, the equality of women. The men folk have ruled all these years and kept the women subdued or under pressure. The women folk are now coming out, are showing that they are as good, as clever, and as capable as the men folk. And I would positively encourage that.
Sir, what is, and it's a question which I would like to know from you really, what is religion to you or spirituality?
To me, myself, it means a lot. I'm not a person who would sit for hours and pray, pray, pray. But I pray each time I start a surgery. I pray each time I'm in difficulty. My prayers are very short. It's only God be with me. And when I pray, I don't ask God for more. I thank God for whatever God has given me. I thank God to give me good health and happiness. In life, good health and happiness mean a lot. Mean a lot. I really observe people and I feel so happy when I see on the roadside beggars' children with an ordinary stick and a ball playing cricket and so happy and jumpy and full of energy, while a child of that 5 or 6 years old coming for a highly sophisticated family, very delicate, not down to earth, not having any problems, and yet unhappy. So happiness, and if one can spread more happiness in whatever way you can, is very, very important in life.
Sir, it has been inspiring for me listening to you, and it's been so touching. There is just, it's been, I was just looking at it. It has been about 2 hours past, and I didn't realize that it has passed. What do you do in a crisis, sir? Because there's so many crises which every human being goes into.
One more thing about religion. I respect every religion. And when fanatism comes in that religion, I do respect it. But my confidence in that religion starts going down. Every religion has got good points. It's a way of life that the religion is supposed to guide us. And when the fanatism comes in, all the good that religion can do is completely destroyed. Now, your last question.
Sir?
When am I the coolest?
Yes.
Is when emergency comes. My mind is so cool, I would think properly, what is the best way out? I would never hesitate even a second to call the second person to help me. And same way, there are many, many times when other doctors in problems during an operation or surgery, they call me, I just go without any air, just help them out and walk out without any. And when they offer fees, I say no.
So it's been beautiful, and I was just remembering 2 small lines because these affect all of us. कि वक्त सबको मिलता है जिंदगी बदलने के लिए, पर जिंदगी दोबारा नहीं मिलती वक्त बदलने के लिए. And on this note, I'd like to ask you my last question. Would you live the same life again, sir?
Yeah. God has been very kind. My life is full of happiness, opportunity to travel around the world, see the world, opportunity to be recognized by other doctors, not only in India, but in other countries too. And I'll tell a very short story. We were in Morocco, my wife and myself, after a long holiday trip for a conference. And we were standing in the queue of the hotel. And when my turn came, and I showed the letter of in Morocco French, and very rude and rough people. So the guy just said, nothing doing. Your registration is not there. So I was and speaking in English had no meaning. he would just say, speak in French, speak in French. So I was getting so nervous, and we have just traveled, our luggage was there, the hotel, where am I to search at 5:36 in the evening for a new hotel? And it was impossible. And suddenly, from the back, a local doctor who had come to Bombay and I trained her years back just tapped on my shoulder. They said, Dr. Soonawalla. I said, yeah. He just took my paper and in French, he fired that guy so much, immediately he took my form and booked the room for us. So this is a godsend. Whenever in trouble, I found somebody just coming out and helping me.
Lovely, sir. Thank you so much. You really have.
No, I would like to thank your whole organization for giving me this opportunity to share the happiness of my life with you all. And thank you for the...
Right, sir. Sir, Mr. D.P. Satpathy, who's the Vice President of INTAS and the head of the Women's Health Business, he's not only helped me in conceptualizing the program, but also has helped me identify the masters and provided me technical and logical support to design this program. I would just like to move the mic to Mr. Satpathy.
And
Mr.
two things I would say. I would like to thank one of my patients who, the moment she knew that there was an interview, sent me this beautiful bouquet of flowers. And
Wow.
thank you for this very fancy shield. I will really keep it so that I can see it each time and enjoy this 2 hours of time spent with you.
It has been.
Thank you.
Yes, Mr.
Thank you, Dr. Jindal. As the saying goes, when you master the past, you are a scholar. When you master the present, you are a saint. And when you master the future, you are a sage. It stands true for you, Dr. Soonawalla, and it was indeed an honor to have you here in this program today evening. Thank you, sir, for sharing your journey, the human side of you. It was not only inspiring, I'm sure it would help each one of us to introspect our life from the other side. I would have loved to come there personally to hand over the memento, but the current situation didn't allow me. But the first chance I get to come and meet you, I'll definitely come and visit you, sir. And I would request to please accept the memento on behalf of us from all the family members present there.
Thank you. Thank you for the recognition and this opportunity I got to be able to talk with
It's
my
all our
friends
pleasure and
and
honor, sir.
fellow doctors.
Such a pleasure,
And
sir.
Dr. Jindal, I think few words for you. Like there is a funny saying which says that people are like tea bags. You don't know how strong and flavored they are unless you put them in hot water.
Thank you so much.
This stands true for you. This COVID
Thank
situation
you.
has showcased the human side of you in true sense. I'm sure if you would not have spent those precious 7-8 years in practicing medicine, you would have been a celebrity by now. So I would like to thank all the viewers, Dr. Soonawalla, Dr. Jindal again, and wishing you all a very happy Independence Day, and see you again in our next episode of the other side of Masters, or the human side of Masters. Thank you again, and good night.
Thank you.
Okay. Yeah.
Thank you very much, sir.
Thank you.
Thank you so much. Because at 92, to be so coherent, first of all, I'm not sure if 92 would be touched. And the second thing, one thing is definite, that at 92,
No.
this will not be as coherent.
I'll correct you. I'm not yet 92. In a few months, I'll be 92.
92. Thank you, sir. Thank you very much for touching, moving, and inspiring all of us. And thank you, everybody, for attending this program.
Thank you.
Thank you. Thank you.